over a specific period. And as a reminder, when we use the term population, that can be big or small, in a country, in a neighborhood, in a specific hospital facility, right? And then a set period of time. So we can determine those factors. So we could say, for example, the mortality rate from heart disease in the United States was X number of deaths per 100,000 people in 2022. So that's a statistic about mortality. Now, morbidity refers to illness or disease, okay? It encompasses the presence of the disease among an individual or among the community, or of the condition or a symptom within that population. So we could say the morbidity rate of diabetes could refer to how many people in a population are living with diabetes at this time. Other things that we look at is incidence. A little more terminology that's useful. Incidence. These are new cases of a disease in a specific time period. And prevalence. Prevalence is the total number of existing cases, new and old, at a given time. So, in short, mortality, death, morbidity, disease, incidence, new cases, prevalence, total cases. And these are terms that will be popping up all the time. All right, other things that have been researched. When we think about racial disparities, that it has direct impact on some of these numbers we just described. That chronic stress, they've been saying, due to discrimination, has been linked to psychological and physiological outcomes that could lead to what we call premature death, partially due to the lack of accessing care, not going to the doctor, fear of going to the doctor, having a bad experience previously, not going to the doctor. And so we see things like type 2 diabetes mellitus, we see neurological and cardiovascular issues, hypertension is quite common also. And with this, because sometimes dollars and numbers speak volumes to some folks, is that if we were to get rid of these disparities, in particular racial disparities, $135 billion of lost productivity and other health costs would be eliminated. And the thought is that by 2015, the economy could grow by $8 trillion. Just think about this. When someone's unhealthy, if we want to bring it into the economics side of things, and you probably talked about this in healthcare systems or things like that, when someone's sick, if they're missing work, that might seem like just not a big thing. That person's missing a day of work, they're taking PTO if they have it. It's not just impacting that individual, but it starts to impact the organization, which then impacts the healthcare system. And collectively, this then can impact the economy. When people are not able to engage in the economy, and for better or worse, we are a capitalistic society. When folks in this society can't engage in the economy of capitalism,